So one of the common things we see in clinic is an Achilles tendinopathy. Used to be called Achilles tendinitis, and this is where you get pain and inflammation in and around the Achilles tendon. Now these can be caused by one acute episode, one trauma, but most commonly what we see in clinic is an overuse injury, where we've done too much too soon and haven't given your Achilles tendon a chance to get used to the activity you're doing. We see this commonly in January when, after spending the Christmas period non-exercising, everyone starts to get fit in January and tends to give themselves an Achilles tendon problem. And the Achilles tendon is particularly vulnerable to this because it doesn't have a great blood supply, and so it's quite slow to get used to what activity that you're attempting. These are split commonly into two main types. So an insertional Achilles tendon problem, and that is one where the point where the Achilles tendon meets the bone, and a mid-portion tendon. A mid-portion is the middle portion of the tendon that doesn't have a great blood supply. Either of these two areas can get inflamed and swollen, and these tend to thicken up, and sometimes you can feel a lump in the mid-portion or a lump at the bone. And we have ways of treating this. The majority of the time we like to begin to load this, i.e. to make it stronger. The stronger it is, the less likely it is to hurt with whatever activity you want to do. And then we add things in and around that to help speed up the recovery, and things like shockwave therapy and platelet-rich plasma injections are very good at speeding up the recovery process. And then sometimes if symptoms are exacerbated by the rehab we're asking you to do, and sometimes that's the case, the rehab's still the right thing to do, it just irritates the tendon when it's inflamed. There's an injection called a high volume hydrodissection injection. It's predominantly water and local anesthetic, and we inject that. Sometimes at the insertion we might use a corticosteroid. Rarely, that's kind of fallen out of favour now. And the majority of these interventions are with the idea to avoid surgery in this region, which tends to have quite a long recovery. But if it fails to resolve with conservative methods, that tends to be the next step.